Hello, how are you?
Oh, I'm fine.
My name is Collette Moore. I'm a student nurse practitioner, and today I will be performing a thorax and lung examination. Can I have your full name?
Yamaya Watson.
Can I have your date of birth?
August 19, 2002.
So you're 18.
Yes.
Do you consent that I will be performing this thorax and lung examination on you today?
Yes.
And do you also consent that I will be recording it, uploading it to YouTube for my instructor to view?
Yes.
Okay, before we get started, I'm just going to wash my hands. This video will involve me inspecting, palpating, percussing, and auscultating. So the first part of my exam, it would include the inspection. I am checking for shape and configuration. I am checking the chest wall. I am making sure that it is symmetrical. It is even and aligned with the scapula. There is no deformities and there is no chest wall protrusion. So I see that her chest is very symmetrical. There's no protrusion. There's no deformity. I am also looking at her rate of her breathing. I'm going to make sure that it is not rapid, that her breathing is effortlessly, that she is not having any use of her accessory muscles. And I'm looking at her. She's sitting in an upright position. She is relaxed. She is not having any problems with her breathing. There is no tripoding. There is no grunting. There is no use of her accessory muscles. And she is breathing at a normal rate. Her respirations are even and they are unlabored. So now I'm going to move on to finish with the inspection. I'm going to turn her laterally. I'm looking at the anterior and posterior to the transverse ratio, and it is 2/1. Moving on, I am also looking at her hands. Can you put your hands out for me? I am looking at her nails. I am making sure there is no clubbing. I am looking for any bluish discoloration. I am checking the capillary refill. It is less than 3 seconds. I am also looking at her lips. I'm not noticing any cyanosis and I'm not noticing any blue discoloration in her lips. So moving on, I will palpate. Move on to the palpation part of the exam. Palpation is going to involve me using my hands. I am going to be palpating for any tenderness or any pain. I am going to be at the costocrondylar region of the lung fields of the diaphragm. I'm going to be taking my hand and I'm going to be feeling. Are you having any tenderness or any pain?
No.
Again, at the costocondral space, which is the cartilage in between the joints that I am feeling and I am palpating. Any pain?
No.
Okay. Also going to be palpating her laterally. Feel anything under the lung and her next lateral side. See if I feel anything under the lung. I am also going to be turning her around, and I am going to be checking her posteriorly by palpating. Also, again, by inspecting, making sure there's nothing abnormal about her symmetry of her breathing. Okay. Now that I have her posteriorly, I'm going to perform what's called the respiratory excursion exam. So I'm going to take the palm of my hands and I'm going to have her take a deep breath. I'm going to be at the 10th space, and I'm going to have her take a deep breath in, about the 10th rep, very deep breath in. I'm going to take my hand, I'm going to cup it inside, I'm going to grab the skin fold, have her take a deep breath in. Okay, relax. It is symmetrical on both sides, which is a normal finding to find that it rises evenly, symmetrically on both sides. So I am going to turn her around again, and I will perform the respiratory excursion also in the anterior portion. Again, taking my hands, cup-like motion, grabbing the skin folds, and have her take a really deep breath in. Again, as you can see, it is even symmetrically. There is no abnormal movement. They move evenly on both sides bilaterally, which is a normal finding. The next thing I will do is palpate for tactile fremitus. So I would take the palms of my hand and I will be checking for tactile fremitus. Tactile fremitus is when you're taking your hand and you're moving down, having the patient say 99, and you're following the sound. You're making sure that the sound is even with the vibration of your hand, which is a normal finding. So I will take my hand and I will start performing a tactile fremitus. I would have you say the words 99 as loud as you can, please, for the recording. Ready?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, I can feel the vibration on my hand as the sound is coming out of her. Again, checking for tactile fremitus. I will do the same on the back side. So I have her turn around. Have you say the words 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now I'm going to have her turn back around. And I will be checking for costochondral tenderness. I'll be at the scapula and I'll be asking her if she has any pain or tenderness as I palpate. Are you having any pain or tenderness?
No.
Okay, good. Like I did this already. Any pain, any tenderness?
No.
Okay, good. I'll turn her around. Any pain, any tenderness?
No.
Again, checking the costochondral spaces for any tenderness. So now, I did the tactile fremitus, respiratory excursion. Now I am going to move on to my percussion part of my exam. So I'm going to have her turn around and I'll be taking my dominant hand, middle finger, and then the middle finger of my hand, and I'll be percussing over all lung fields. I'll start off anteriorly. So what I'm checking is for renaissance sounds. And I will do this in an even fashion using the ladder technique. Okay, I have did this anteriorly. I'm just going to have her lift her and I will do the axillary 3 points. Okay. Okay. Okay, then I'm going to have her turn around posteriorly and then do the posterior end of the percussions. Again, taking my middle finger on my dominant hand and then tapping in an equal fashion. While I have her posteriorly, I can perform the diaphoretic excursion measurement test, which I will be percussing, and then I will be measuring as she takes a deep breath in. So I am going to start percussing. Take a deep breath in. And I'm going to measure where she took her deep breath in. Take my marking pen and I'm going to mark it. Then I'm going to ask her to exhale as I percuss. Exhale out. Again, marking with my pen. I will take my measuring tape. I will measure. I see she is about 4 centimeters, which is a normal finding. The normal finding is 3 to 6 millimeters. And for the purpose of this video, I will verbalize that I have did both sides and that they are equal on both sides at 4 centimeters each bilaterally. Moving on to the auscultation part of my exam. All right. I have checked all lung fills with the palpitation and percussions. Now I will do the auscultation. I will use the diaphragm of my stethoscope and I will auscultate all lung fills. So I'm going to have her turn around facing the camera. And I'm going to take my stethoscope, again using the diaphragm. I'm going to start at the apices, A-P-I-C-E-S. I'm going to place it in the space of the apices. I'm going to have her take a deep breath in and out. Moving in an even fashion, the ladder technique, so I can hear it symmetrically on both sides. Deep breath in and out. Deep breath in and out. Okay, I've did the anterior portion. I will have her turn around and I will do the posterior portion. Again, starting in an equal fashion bilaterally, so I can have equal sounds bilaterally. Deep breath in and out. Deep breath in. I am holding my stethoscope while she's taking a deep breath in and out. Okay, I have auscultated anterior and posteriorly. I did the, now I would do the right lateral side. Where's your, the right? So I'll take my stethoscope again. Is this your right? Okay, to her right. And then have her take a deep breath in and out. Check in the 3 points. And then I'll have her check her other lateral side on the left. So bad with directions. Okay. Again, checking the 3 points. I don't hear any rhonchi. I don't hear any rhesus. I don't hear any adventitious sounds. No crackles. No rhonchi, no wheezes, no rails. Nothing that's adventitious. I only hear vestibular lung sound, which are a normal finding. So now that I found the normal finding, I am going to go on to a special test. The special test that I choose to perform in this video is called the bronchophony test. Now the bronchophony test, I am going to be using my stethoscope. I'm going to have the patient say 99 and I will be listening for any over the bronchi. So this test will perform any abnormal sounds over the bronchi, and what this test for is for consolidation, which you can find in something like pneumonia. So I'm going to have her turn back to her posterior part. I'm going to use the stethoscope and have her repeat the words 99 during the bronchophony test. Can you repeat the word 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now that is the bronchophony test. I didn't hear anything abnormal, so this completes my lung and thorax examination. Thank you so much for watching, and thank you so much, Jemiah, for participating.